It's a very unique clinic.
We're interested in spreading the word that we're here.
I feel like they treat people how they're supposed to be treated. Yeah. I've been coming here since I was really little.
They give me advice on this and that, and yeah, they help me a lot.
I love it here. This is the best place I've ever worked, and it's very enjoyable. I like making a difference for the community.
We deal with the family from beginning to end.
But the quality of care that they get here, I don't think you can even get at a private practice.
The staff is wonderful, wonderful to work with, and they're wonderful with you.
But here, people say, go to CHASS, and that's their first avenue, and they will tell other people about us. And it's a great thing.
And you know you made a difference, and that's, for me, priceless.
Since 1970, Detroit's Community Health and Social Services Center has been providing primary care and wellness services to the uninsured and underinsured. The center is regarded as a model for successful urban health care, and to its patients and staff, it's more than just a clinic.
Last year we saw about 13,500 unduplicated users. That would be all of our 3 sites, including our school-based health center.
They actually do have a medical home, which is one of our goals, that every person in the community would have a medical home.
Because we have so many different services here, from the lab to the pharmacy, to an OB clinic, to just seeing their doctor. So you get to know the patients and they get to feel at home here.
The extra step that we take on giving them the education or the extra counseling that they may need, the multi-services that we have here, it's a one-stop shop deal that you don't have to go down the street or you don't have to go 10 miles away to receive the counseling or treatment that you may need.
As a matter of fact, one of the staff members went with me to the doctor once.
Oh yeah?
Yes, and they wanted to know from the doctor what would help me and what would help them.
They're not a stranger, they're not walking in, and they aren't being treated for one little teeny incident in their life. They're being treated as a total person with a whole medical history. And that's very important in getting good health care.
For the people of Detroit, CHASS is an important part of their health care and communities.
Clients that have gone through, I've seen them as teenagers. They've come here as now pregnant mothers. Their kids are growing up, and it's weird how time flies.
Yeah, my sisters, my cousins, my aunts, pretty much all, my whole family has been coming here.
People who do have insurance love to come here for that community feel.
It's like a gathering place. There's times where people just come and they just chit-chat and just have no worries.
I think it helps a lot out with the community and the people who live here in the community.
You see the results of your efforts here. It makes a real difference in the community.
So I can see around, it's not only me, I can see other people have benefits with these programs.
Well, our patients feel real safe. They feel comfortable in an environment where all of the employees know the culture, know the language, and can communicate to them and understand where they're coming from.
Many of the people who are here serving the community live in the community, come out of the community, and maybe as children or young people, they came to this clinic. They know how important it is to people.
With a rich past, CHASS looks towards building the future.
The patients, they deserve the best. No matter what income value, whatever economic strata they're on, they deserve the best.
Well, if we do everything right, we're headed toward a new, beautiful center, a real center, one that's designed to serve health needs, and that is not a makeshift former auto dealership.
And we'll be able to see so many more patients.
We'll be able to give them, I think, better care in the sense that we'll be able to have, hopefully, x-ray machines there that we don't have to send clients out. We'll be able to do our own ultrasounds on site.
But also I think of all the future patients that we haven't yet encountered.
We're going to be in a beautiful center that speaks to the community and says we really value you, we believe in you, and It's going to be great. You have to come back and see us.
It's one of those community things, whether it's a small community we're talking about a street or neighborhood or even hopefully more global. You know, you really kind of want to take care of one another, and just the fact that this clinic is here makes me, I think, happy to know that we still care about people.